Hello and welcome to the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. Our guest today is Reverend Keron Sadler. She's the National Health Manager for the Health Department of the NAACP. And today we're talking about HIV/AIDS. Welcome.
Thank you. Glad to be here.
Now we're talking about HIV/AIDS, which is something we should be talking about all the time.
Yes.
But we're particularly talking about it now because World AIDS Day just passed.
Yes, World AIDS Day is always December the 1st, and so it was this past Friday, actually, and social media was on fire with it, and awareness was really being raised, and it is something that we should always be discussing whenever we have an opportunity to raise awareness in order to dispel myths, in order to decrease stigma, and so encourage people to get tested so they know their status.
Now, Reverend Sadler, years ago, 20, 30 years ago, when we thought of someone having AIDS, it was a death sentence. I had a dear friend die back in the mid-'80s of AIDS. Nowadays, it's not so much a death sentence, it's something that you can live with, but there's still a lot of stigma attached to it.
It is, and you're absolutely correct. It is something that we can live with if we are diagnosed with having HIV. The key is the earlier that you are diagnosed, the sooner you can know your status, the sooner you can get in care. And often what people don't realize is that once you're in care, you have to remain medically compliant. So a lot of times the death sentence mentality comes from the lack of knowledge and the lack of people just don't know the facts associated with how to live a healthy life. It's like, I don't want to minimize it, but although it is like any other chronic disease or illness, however, it is one of those that's still taboo that people don't want to talk about or don't understand or feel the need to talk about, but we must talk about it. And a lot of times people don't want to talk about it because of the topics that may be associated with it, such as sex or sexuality.
Now, you all, the NAACP is partnering with churches in helping to raise awareness for this. Why did you choose the church community?
Great question. Actually, the partnership is with Gilead Sciences. They are our funding partner to help us do this work nationally. We're actually in 30 cities through a commitment to action through CGI, which is the Clinton Global Initiative. And so we started this initiative or the work back in 2010. It was actually executed in 2012. We realized that the faith community was so important and so relevant because of the capacity, and more so because how it is well respected and viewed in our community. Even from I can remember being a little girl, it is the pastor, whether it's a he or she, that people look to for information, for resources, for empowerment, for uplifting. And so what a better place to go where people feel safe, to utilize or to leverage as an avenue to raise awareness around this epidemic.
You are so right about church. You see when politicians want to win an election, you go to the church. Mm-hmm. Anytime, it appears that anytime you want to reach the African American community, you got to reach out to the churches.
That is exactly right. And actually, when I talk about leveraging the relationship in the Black community in the church, I use that very same example, how politicians do come because they understand the reach and the capacity, and it's a trusted, safe space. The key here is that we must really understand. So if politicians realize that that is a safe place and that there's a capacity there, because there's power in our numbers. So we're often considered the minority, but when we come together, we have significant power. So I often say, what would happen if more churches got on board and began to raise awareness around HIV? How many more people can we save lives, in addition to decrease the number of new infections? We are a powerful organization as a Black community if we just ever realize that. And then secondly, if we really just stop the judgment and just learn to realize that God created us all, He loves us all.
Well, let's get to the meat of it. What are some of the myths and objections when it comes to HIV/AIDS?
Well, it was really sad. Even in the work that we do, we still hear that it is a curse from God. Unfortunately, people still think it's a gay disease. It is a disease that anyone can contract, white, black, green, yellow, It is no respect of person, age, or color. If you are having unprotected sex, you are at risk for contracting or transmitting HIV and AIDS. Well, we hear that people still think that you can contract it from touching or hugging, kissing. There's a lot of things that people still, just because they haven't educated themselves around the facts, are allowing that to sort of drive the reason why they want to remain hands-off.
I remember so vividly how years ago people would, you can get it from sitting on toilet seats. Mm-hmm. You can get it from kissing someone.
Those are being myths, yes.
Yes, those are definitely myths of how, and it's just astounding that here we sit so many years later and people still believe those things.
Absolutely.
Although you can get it from sexual transmission.
Absolutely.
Also, IV drug use.
Absolutely.
Is something else.
Absolutely. In addition, another one that people don't think about would be mother to child, whether it's breastfeeding, or if the mother is not medically compliant and she's not on medication, she can transmit it vaginally during birth. So yes, those are the ways that you would transmit it.
Now, are we seeing a lot of newly infected people from the heterosexual community, or is it still more coming from the homosexual community?
So I would say it's all relative. I can say that the numbers are increasing, and it varies. People often think that because I use the term seasoned saints, which is our elderly or older demographic, people often think that they are not having sex, but that happens to be a demographic in the heterosexual community where the numbers are rising for many reasons. And the one thing that we often don't talk about are the disparities that are associated with HIV. It's not because we're Black that we have HIV or that our rates are higher. It is because of the disparities that the social and the racial disparities that we face as human beings. Another demographic that numbers are high happens to be what the CDC, the Center for Disease Control, refers to as the Msm population, which is men having sex with men. And I personally feel like that is a particular demographic that the numbers would continue to rise because of the stigma that's around those that are a part of the LGBT community, because of the stigma, the judgment, and the condemnation that's associated with that, just, regardless of what your spiritual or theological beliefs may be.
Let's go back to the elderly community. How is this?
I saw your face.
How is this happening, or how
nursing homes? First of the month, people do things because maybe I may have a bill that I need to have paid, or I'm having unprotected sex or having sex. And at the end of the day, there are medications that if things don't work, you can get them to work, because we are human. And the conversation that we don't want to have and we need to have is that God created us as sexual human beings. Sex is wonderful. I think we as humans growing up have tainted what sex is and what it can be, but it's beautiful. So because we're sexual beings, we want to be intimate, we want to be loved, we want to be touched. And so regardless of your age, you have a desire to connect with someone in an intimate and romantic way.
And so this is how it's spreading in the elderly community. Mm-hmm. What kind of information do you find that you all have to give nowadays? What are you putting out there to gain awareness, to give people awareness of what's going on?
Well, as I mentioned, the initiative launched in 2012, and so we have a toolkit. The initiative is called the Black Church and HIV, the Social Justice Imperative. And you can actually go to the website. It's www.theblackchurchandhiv.org. And you can download all types of resources, all types of information. There are actual links you can go to actually take you to other sites that can provide you with statistical information as it relates to specific cities that we are actually traveling to. But the information that we give out is always around this toolkit, which is being begged for, asked for. People really want this, and it's twofold. It actually has a pastoral brief in addition to an activity manual, which is more in depth about the how-tos to do work around advocacy and raising awareness, and how do you engage when someone discloses their status, and it's just very informational. So I encourage everyone to go to the website and download it and to read the toolkit. Again, it's www.theblackchurchandhiv.org. So that is one thing. When it comes to information and resources, you sort of have to gauge your audience when you go. You have some churches that are very, very legalistic and traditional, and they really don't want to talk about it. So you have to really maneuver and just raise awareness and help people understand that there are churches that are doing something. And so they may want to partner with them to sort of hear and learn some of the basics things that they can do, such as provide screenings and testing in their community. And then the other churches that are doing great things that are more radical, and they are providing condoms, and they are being more inclusive. So when we go out and speak, we focus on the fact that HIV is a social justice issue because of, again, the disparities that are associated with it, whether it's racial, social, or health disparities are associated. And we help people to really understand that we've got to have this conversation so that, not only do we want people to be saved and go to heaven, we want them to be able to live a long, healthy life regardless. And we have choices, and let people know that they have those choices.
One of the complaints about the African American church when it comes to HIV/AIDS is that the African American church hasn't been maybe as inclusive as it should be.
Mm-hmm. That is very true, and it goes back to my statement earlier, is that we have to really remember, I grew up in the church, and so I can speak from a church perspective from many levels, from being a little girl, Sunday school secretary, Sunday school teacher. I was a first lady. I'm an ordained elder in my denomination, so I can speak to the church from many capacities. And the church, has been referenced as a hospital, but the church can also be a very hurtful place. And so because of the judgment, because we're, the Bible talks about how Jesus did one thing more than anything, and that was love. But oftentimes we fail to love one another. And, that is a whole nother conversation, because that also has to do with how we love ourselves. So if I don't love myself, it's hard for me to love someone else. But at the end of the day, we are all God's creation. He loves us all. So regardless, again, of our theological views or our biases or our judgment, we should love one another because we're human, and meet people right where they are. Some of the greatest ministry happens when I meet you right where you are versus trying to change you or mold you into who or how I think you should be.
So you all, you say you travel the country.
Yes.
So you're trying to get churches throughout the country. It's not just in this local area. You're trying to do a nationwide.
Yes. So actually,
effort.
on the website, you can actually see the 30 cities we've been at or been in over the since 2012, up and through. We just did our last one in New York. It was phenomenal, Brooklyn, New York, actually. But yes, we are going around to actually engage faith leaders. And so the initiative is the three-pronged approach initiative. So one happens to be where we go around in the 30 cities and work with faith leaders on a local level who are key players. So we are looking for those pastors who are doing nothing around HIV in their communities because they just don't understand, but maybe they want to understand or may need to understand, and partnering them with the health departments and other CBOs, community-based organizations, or AIDS service organizations, and pastors who are actually doing something, because we fail to realize that there are pastors who are doing phenomenal work in the HIV community. And so because they have these best practices, which are also listed in the toolkit, we want other pastors who may not be doing as much or nothing to partner with them to do something. The second approach we have, or the prong approach we have, happens to be within our seminaries, because we're hoping that pastors or leaders are going to seminary. Some may not, but that is at least one place that even some lay people go to understand the Bible, understand the church, understand administration, how the church operates. And so we go in there, we lecture in a core course where the professor actually integrates this toolkit as a required reading, and we come in and we raise awareness around, again, HIV, dispelling the myths, in addition to helping them understand why this is a social justice issue. And then the third prong approach happens to be among denominations. So it's sort of like you're working from the ground up, the tier, so local, seminary, as well as denominational level, where you have many churches and many leaders that we're able to reach to actually encourage them to partner with us to ratify HIV resolution, saying that your denomination will do X, Y, and Z. Whether it could be a screening, it could be partnering with us on our annual Day of Unity, which is always the first Sunday leading up to our national NAACP convention, or partnering with someone around World AIDS Day, but whatever, just doing something as a denomination with your pastors and your leaders and your churches and your community to raise awareness around this epidemic.
Are you guys working on any initiatives dealing with the LGBT community?
At the moment, we are not doing anything specific related to the LGBT community. However, the association is in a new phase where we have a phenomenal new leader. We're really excited about where the association is moving.
This is a new leader for
our new president CEO, yes. And so you can go to our website, which is the, NAACP.org, and read about Attorney Johnson. He's also very familiar with the field. So he was a state conference president. He's was a board member, and he is now he was an interim president, and now he's our president. So we're excited to have him on board, and he is really for the people. And so as we are focusing on revamping and retooling and visioning ourselves in the community to continue to be relevant, we are actually embracing the LGBT community more so than we have in the past, because it is about human rights. It's about rights, civil rights, a lot of rights that people don't think that are applicable to all people, but they are. So we are actually moving into a greater space, and we're still defining that. And what's amazing is that people are looking to partner with us who are part of various LGBTQ organizations, which is exciting.
Now, when you go out into the community, when you go to different states, different regions of the country, what is the most frequently asked question nowadays when it comes to HIV/AIDS, when it comes to raising awareness? What are the people saying?
A lot of times people just want to know, what can I do? How can I get this toolkit to share? I've had people actually duplicate this and take it to various, literally drive in their community and take it to various pastors just to raise awareness. So people really want to know, what can I do to raise awareness? And so again, I encourage people to go to the website, the blackchurchandhiv.org, download materials, share it in your bulletins at the church, post it in the vegetable views, hand them out, have conversations about it at Thanksgiving dinner, Christmas dinner, in the libraries or in the grocery stores. Talk about it, but we have to have the conversation that seems to be very difficult for many.
It is absolutely very difficult for many. I have a sister, my oldest sister, she's a nurse in an HIV clinic.
Oh, wonderful.
And that's one of the reasons I've never done this issue on this show before.
Awesome.
That's another one of the reasons I wanted to do it, in dedication of the work that she and the doctors and nurses have done towards that. Modern medicine, of course, has changed the face of AIDS, and I'm talking about worldwide.
Absolutely.
Where, as we discussed earlier in the program, people are not dying as much as they were. People are living, but making sure that they get the screenings and things that are necessary. Some people live in denial and they don't want to get tested.
Absolutely.
And you have to.
Absolutely. And I often hear people say, or think, or assume, it won't happen to me. It can't happen to anybody in my family until it really does happen to someone that you know, or it does happen to you. But if you, again, just go get tested. I personally make it a part of my normal routine. When you go, hopefully everyone who's listening and watching are going to the doctor, doing their annual routine visits. Just ask, they're taking blood anyway. Ask them to test you for HIV and other STDs so you know your status. And it could be like, you may not have had sex or been intimate in years, but you may be living with it. And so the sooner you realize that you may have HIV, the sooner you can get into care. And
of course, there are medications nowadays. It's not like back in the days where you have to take 15 cocktails or whatever. It's a new day. It's a new day with that. Have you seen there's still more research into AIDS and treatments and stuff like that? There was an investment, it seemed like 2 decades ago, in it, but you just don't hear about it as much as you did.
Well, I think unfortunately, of course, there's research. The only problem with the research from a clinical perspective would be that there are not a lot of us that's present. And I think it's important to have a presence, our presence there, so we have people who represent us, who understand us, and know the needs that are associated with us. So I encourage people who are maybe starting out in school, consider research in this field if you're African American or a person of color, so that you can continue to help move the system forward where we benefit as a community, because it's about changing systems.
Why do you think so many new infections are happening within the African American community?
Well, again, we are disproportionately impacted or affected because of the disparities, because we don't address mass incarceration. We don't address that people are going into the system and not being tested and then possibly contracting it there and then coming out, trying to re-enter into society as much as normal as possible, and then coming out infected and then infecting others. That's the way. We don't address the, let's talk about healthcare or the lack of quality healthcare. We don't talk about those issues that are associated with that.
And we're all traditionally, when it comes to things like breast cancer, we traditionally are diagnosed late.
Absolutely.
That's why we die at a higher rate.
Absolutely.
Is it the same way with HIV/AIDS?
We have to, as a community, invest more in our personal health. As I just said a moment ago, we've got to go and have those routine visits. I often say, go get your physical exam once a year, get your girl exam once a year, get your eyes checked once a year, dental exam every 6 months. Like, we must do those things to make sure we are living healthy. The new saying is, our wealth is our health, or not health is our wealth. We've got to view it that way. We often talk about money. Everything's about money and monetary things.
Yes.
But if I'm not healthy, I can't go to work.
And like you said, that is worth $1 million, having your health. And some people, I don't want to know. You do want to know, because you don't know who you can infect.
That's right. And again, the sooner you know, the better. The sooner you know, the sooner you can get into care. And that's what's really, really important.
You also mentioned earlier some of the new numbers when it comes to mothers and children, how they're passing on to their children. What are you seeing in that area?
So again, this goes back to the key of being medically compliant. So if I am a mother and I'm medically compliant, it really helps minimize the risk of transmission from me to my child, whether I'm breastfeeding or giving birth. So it goes back to knowing your status. It goes back to getting into care, and it goes back to whatever your doctor instructs you to do that. I can just think about people who go to the doctor and they're sick, and the doctor gives you antibiotics. Well, you feel better, so you stop taking your medicine. Like, how often do we do that? So, when you go and you're living with HIV, it's important that you remain medically compliant so you can live a long life, because it's not a death sentence, and it doesn't have to be.
That is so true. You go to the doctor and, hey, you have an infection, and 3 days later you start feeling better because you've been taking the antibiotics. Why stop? People will stop taking the medicine when they feel better, and especially when you're dealing with something as serious as HIV/AIDS, you've got to be compliant.
Yes, that is absolutely correct. And so again, we as a community, we must do a better job of having hard conversations. We must do a better job of understanding our rights as a community, our options as a community. If there's options that we feel we don't have, we must go and fight for our rights, fight for our options that other people have access to that we may not have access to. We've got to unify, and we've got to come together as a community so that we can continue, so we can work toward dispelling those or addressing those disparities, so we can begin to get rid of them, so we can experience equity and equality.
Again, as we wrap up the program, can you give the name of the initiative?
Absolutely. So it's the Black Church and HIV, the Social Justice Imperative, and the website is theblackchurchandhiv.org.
And of course, we're going to put that information at the end of the program so that people, if they're interested in finding out more. And you said that the website links you to all kinds of information.
Resources, absolutely. And I would be totally remiss being here on behalf of the NAACP if I did not encourage people to also become a member. It's $30 a year. We were talking earlier, how many times do we spend $30 on our hair, our nails, for some people cigarettes or drink, bottle, whatever. We spend money on what's important to us. And you never know when you may need the NAACP. You may not even need it, but support the organization because you're helping someone else. You're helping your brother and your sister.
And here we are in 2017 going on 2018, and we see in this world today, organizations like the NAACP are still very relevant.
Absolutely.
And will
Always
be
will be.
relevant in the days to come.
Yes.
Because we have no idea what's going to happen. So the organizations like the NAACP are so important.
Yes, and we have to make that investment. Again, it's only $30, and you can actually become a member online at www.naacp.org.
And what other, before we wrap it up, what other health initiatives are you working on? What other things are you doing in the community?
For the sake of time, because we have several initiatives, I personally oversee HIV, and along with dialysis,
Yes.
renal disease, kidney disease. And so there are other phenomenal initiatives. We were talking a little bit earlier before the show around your focus.
Yes, which is obesity.
Correct. We have work we do around that. So I encourage people to go, when you go to the website for the association at NAACP.org, go up under, I believe you'll find it up under health. And you can see all of the initiatives that are listed. And if you have questions, or if you need maybe some resources, or to leverage some community relationships, feel free to email us at health@naacpnet.org, which is also
because
our
a lot
website.
of people who need help, they just don't say anything. They I don't know where to go. I don't know what to do. And you're giving resources.
Yes, I have a motto. I do not want to be a part of the problem. I want to help be a part of the solution.
Very good. One last question. What made you become involved with this?
So actually, I started working in HIV. I've been doing HIV work for over 10 years now. I started doing work in Charlotte, North Carolina. I was one of their regional directors at an organization called RAIN, which is Regional AIDS Interfaith Network.
Okay.
And so I had a very, very different old boyfriend. His brother was gay, and I saw how it was hard on the family that he was gay, living with HIV, and he ended up dying from AIDS. But the fact that he was gay divided the family.
All right.
And so I just wanted to be an advocate for not only those that are living with HIV and AIDS, but also an advocate for those that are part of the LGBT community.
Well, thank you so much for joining us. We've been talking to Reverend Keron Sadler, and she's with the NAACP. She's the National Health Manager of their health department. You've been watching the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. Have a great day.